Well, during the COVID-19 pandemic, it is very important to continue to see your primary care provider and get all of those regular screenings. We are joined today by Dr. Martin Litman, an internal medicine physician with ETSU Health Internal Medicine out of Kingsport. And Dr. Litman, thank you so much for joining us today.
Thank you as well for having us here.
Well, certainly an important topic. We just saw, I was talking to you earlier on the national news this morning, talking about some of the side effects that we are seeing from this COVID pandemic, and people have really stayed inside and not been getting their screenings.
And that is a significant issue because there are a lot of, since you mentioned cancers, that are preventable if we can catch them while they're small. In women's health, breast cancer, staying on top of those screenings, if found small, they can be treated while they're small. Colon cancers, perfectly treatable and curable if found while they're small. And primary care physicians, we are in charge of setting those type of appointments up, if not assisting to perform those directly ourselves. So one of our challenges is making sure that our folks stay ahead of the common challenges that are not just regionally but nationally.
I was going to say, we've been talking about this on the national level, but you said locally you are seeing those same results.
Yes, unfortunately, in fact, within the last 2 months, within Holston Valley Medical Center, I've taken care of patients that did have early warning signs of cancers a year ago, but due to the issues related to COVID-19 stayed away from their health care centers. And we found them in quite dire straits with significant tumor burden. We've had folks that have had signs of colon cancer, weight loss, rectal bleeding, changes in stooling, and they stayed away, and now we're seeing the negative anticipated consequences of that. And it's heartbreaking. It's a tragedy because for those folks it is literally turning their world upside down, and for the physician, we know that had we gotten to it sooner, there's something we could have done to prevent that.
Absolutely heartbreaking, as you said. And so I know your office and so many others really taking the steps to make sure you are as safe as possible when they do come in.
Absolutely. Our phone room screens every patient before they are given an appointment to try to determine if they have signs or symptoms of COVID-19 or other communicable diseases. If they have those type of issues, physicians are going out and still seeing these patients, but we're seeing them in full PPE in the parking lot, in their cars, and doing an on-site triage to determine whether or not it's appropriate to bring them in the office or if we need to see them and do our full exam in their car away from everyone else, or if we need to send them to a local health facility like Holston Valley or Johnson City Medical Center, etc.
So much of it is emotional and getting away from the fear that they have had over that past year. Your advice to someone at home who right now knows that they are 6 months late, knows that they need to get in for that screening, but still has that anxiety about it.
Sure. Well, that's normal. That's human. But I like to remind my patients that COVID-19 and other viral illnesses, bacterial illnesses, are not isolated to just your healthcare settings. They are literally everywhere. You have a greater chance of coming in contact with COVID-19 at Walmart or at a restaurant as you would at your physician's office. In fact, in a physician's office, you may have a slightly lower incidence or in any healthcare setting, because we're so rigorous and fastidious about our cleaning and our disinfecting of everything. And in general, folks don't see my face. I'm always behind a mask. So we're always doing what the CDC and the national recommendations are for disease prevention.
Well, certainly very important information. Dr. Litman, thank you so much for taking the time joining us today. If you have questions, Kingsport Internal Medicine would be happy to answer them. There is that phone number. But do remember how important your screenings are, even during a pandemic. We'll be right back.